So this area here used to be the nursery of the Martyr Mothers Hospital. So with the HWA funding, we were able to take what was a clinical attribute and convert it to make it useful for educational purposes. They're managing an entire case, and often those skills don't come into question until a real emergency hits. It's very hard to respond in an emergency if you've never had the experience before.
I think the White House facility has opened up enormous opportunities.
This is a teaching aged care facility. So this is where we want to develop a nexus between teaching, research and practice. So a home like the Queen Victoria home originally would have had 6 students a year. We've now increased that to 80. So that's a 1,300% increase in the number of students.
Placements in these rural and regional and remote communities are very, very important in terms of how much they sustain the available health services in rural and regional Australia. These accommodation trailers are able to be moved around from Port Macquarie through to southern Queensland and also west up into places like Armidale.
A refurbished house or a newly built set of units, they're tangible assets. They're things that agencies now have in their hands to promote people staying with that community.
In my day, as a obstetrics and gynaecology medical student, we only ever had placements in the public sector, so you only sat in with gynaecologists and obstetricians. This offers the ability to sit in with general practitioners who are working at the coalface, who spend a lot of time with the patients, a lot of talking, and the students are very appreciative of it. So I see the students as our succession planning, and we want them to be as well trained as we can and as empathetic as we can so that they can come and fill our shoes.
HWA had a strong interest in promoting clinical education in the private sector to try to take advantage of capacity in areas where we've never traditionally trained. We are trying to get what I call bottom-up multidisciplinary training going. We've got a single common room for our students, whether they be nursing students, pharmacy students or medical students. I strongly believe in interactions at that level as one way to understand each other and gain respect.
The idea of having this centre and having the program is that general practice and the practice of medicine in the rural context is seen as being a viable speciality where you're going to get support and specialist training and be practising medicine in a specialist way.
If we can deliver the entire medical program, the entire allied health programs in regional and rural areas, truly embedding them in those communities, you will not only increase the healthcare facilities and the capability of the healthcare in those communities, but you will have a long effect in terms of creating more rural health practitioners. And I think this investment has demonstrated that so amply and I think should be a template for future investment.
It is a tough work environment. It's tough physically, it's tough mentally, and it's tough professionally for those health practitioners working in very remote communities.
So to have these extra rooms made available enables us to just build on that quality education program that we've got.
Following on the end of ward rounds, being the 3rd or 4th student in the line offers very little learning opportunities, but when you're actually able to sit in and see patients themselves, that makes all the difference.
So the reason I want to work in a rural town is the sense of community makes you feel a part of a team, and I guess I just like that because that's where I came from. So I want to get back to my roots basically.
I'll put it this way, this is one of the very few placements I've been on where I've felt that I've been able to add something and that I am considered part of the team by everyone. As a student, you're considered a major addition to the team that they have.
Being able to spend time with the same people and at the same hospital has allowed us to develop parts of medicine that you don't get taught in a standard lecture curriculum. With the size of this facility and the amount of students going through here, I think the benefits are astronomical and you can't really put a money value on it because the value is actually in the healthcare system and helping people.